초동 대응은 빠를수록 완벽할수록 이렇게 좋다. 그리고 그것에 지금 사활이 걸려 있다. 이렇게 저는 말씀드리고 싶습니다.
The daily average of confirmed COVID-19 cases in Seoul is reported as 2.9, despite a series of mass infection crises. Seoul has a population of over 10 million. It is a densely populated metropolis with a high risk of virus infection. But no city lockdown has been made. Fast preemptive response and transparent provision of information. Centering on these two principles, the Seoul metropolitan government cooperated closely with Korea Centers for Disease Control and Prevention. The city government has operated the Seoul Disaster and Safety Countermeasures headquarters for 24 hours a day from the early stages to monitor new infectious diseases and disinfected public transportations and facilities used by many citizens and visitors. Seoul, while monitoring the virus, had also prepared necessary countermeasures against the COVID-19, such as citizens' guidelines, virus testing, contacts management, and quarantine treatment. To contain the virus to not spread to the local community, Seoul was committed to conducting epidemiological investigation, quarantine treatment, and identifying and tracking patients and contacts. Seoul now becomes a model for cities around the world in terms of the COVID-19 quarantine measures. At the request of cities overseas, the Seoul metropolitan government opened an online platform entitled CAC, which stands for Cities Against COVID-19, on April 9th, and has been sharing all information on the COVID-19 quarantine know-hows and countermeasures Seoul has taken so far. However, Seoul has not completely succeeded in COVID-19 quarantine. The first crisis came to Seoul in March, after the country's first outbreak of COVID-19 in January. A mass infection occurred at a call center in Guro district.
서울에서 발생한 집단 감염 가운데 최대 규모의 사례가 나왔습니다.
27명이 추가로 확진된 겁니다.
집단 발생 즉각 대응반을 구성해서 역학 조사를 실시하고 있습니다. 위중하게 이 상황을 인식하고 추가 확산을 막기 위해서 최선을 다하고 있습니다.
Using mobile access records and credit card transactions, the city government identified more than 1,000 contacts and conducted tests for COVID-19. The government asked for citizens for active cooperation for self-quarantine to prevent a second or third transmission of the virus to the community. Call centers and public facilities across Seoul were disinfected thoroughly.
서울시는 시민 모두가 저희들이 그 요청한 대로의 생활 방역을 철저히 해주셨고, 확진 환자 유증상이 발생했을 시에는 각 보건소에 적극적으로 검사를 임함으로써 저희들이 효과를 거두지 않았나 이렇게 생각을 합니다.
After the switch from the social distancing to the distancing in daily life in May, an unexpected mass infection occurred at clubs in Itaewon. Based on the experience of mass infection at the Guro Call Center, the city government tracked down the Itaewon visitors working together with the National Police Agency and the mobile service companies. The Seoul metropolitan government immediately introduced the anonymous testing and operated additional walk-through testing stations.
저희가 서울시에서 4개 드라이빙 스루를 운영하면서 수많은 예심 기자들이 취재 요청이 있어서 중수부원 쪽에서 지침도 협조가 오거나 그런 걸 많이 제공한 걸로 알고 있습니다. 서울시에서는 6월 초부터 선제적 검사를 해가지고 학생이라든지 어린이들, 감염에 취약한 분들이 있는 장소를 찾아가서 선제 검사가 지금 검토 중입니다.
As the number of confirmed cases is rising, Seoul is once again checking quarantine countermeasures against COVID-19 and conducting preemptive virus testings. The distancing in daily life has been further tightened. We must stay alert to this unpredictable virus.
And they are going through a sort of more stringent lockdown than we've had here in South Korea, because the South Korean government and I guess the Seoul government have dealt with the coronavirus in kind of unique ways, particularly in terms of testing and contact tracing and targeted quarantining, the country's been a little bit more successful in keeping the number of cases and the number of deaths down. Well, I think the most important part of, so-called K-quarantine is the contact tracing that needs to take place. In order to contain the virus, you need to know where it came from. And that means that, Western countries, the publics in Western countries are going to need to sacrifice some of their privacy in order for contact tracing to be really effective. That's the biggest lesson that I think other countries and other governments can learn from South Korea's experience in containing the virus.
Along with the immediate response of the government, dedication of the frontline medical workers, and participation of citizens who practice social distancing made it possible for Korea to be a role model in quarantine measures. Yet, COVID-19 will leave much of an impact on our society. It has changed our daily lives, and economic and social damages are also significant. For any possible outbreak in the future, what should we do to prepare? For the world after COVID-19, how can cities in the world cooperate with each other? Now, the world is paying attention to Seoul's next move.